Our Christmas Special Webinar is with Gabriel Weston, TV doctor, author and surgeon. So Gabrielle is a surgeon and best-selling author and award-winning broadcaster, known to many from BBC programmes such as Trust Me, I'm a Doctor and Incredible Medicine, Dr. Weston's Casebook. She trained as an ENT surgeon, continues to practice clinically, and is widely recognised for her ability to bring clarity and comparison to complex areas of medicine. She also has a personal connection to Cavernoma. Her son Sam was just 14 when he was diagnosed with a Cavernoma in the posterior fossa of the brain. He required emergency surgery, and thankfully the operation was successful. And the reason we got to know Gabrielle was through her book, Alive, an Alternative Anatomy, in which she talked about this, and for which we're very grateful that you are helping to raise awareness of Cavernoma. So we're incredibly fortunate to have you here today. Thank you so much for joining.
It's so nice to be here, Helen, and hi to everyone watching. Obviously, I can't see you, but I'm glad you can see me, and I'm really looking forward to having a chat about my experiences of Cavernoma this evening.
Oh, that's wonderful. So for those who join our normal webinars, often we have somebody present. And Gabrielle, when you and I were talking about this, we had that chat about actually for this one, it might be nice to do it more as a conversation, which I thought was a lovely idea. So I've written down a few questions. I'm sure some will come. But a nice one I thought to begin with is, many people recognise you, but some may not know your story and have not had an opportunity to read one of your fabulous books. So could you tell us a little bit about, the beginning of your journey? I understand you studied English, I think it was, and then to becoming a surgeon and then a writer and a broadcaster. I mean, extraordinary journey. How did that happen?
Yeah, so it was kind of unexpected for me. So I was not the classic medical student in the making. I was terrible at maths and science at school. I actually gave them up by the time I was 15, just did a biology O level and did really badly at it. And so I went off to do an English and philosophy degree, which was kind of the thing that I was strongest at school. And it was during the middle of that degree that I started noticing that when people got sick or had an accident or there was kind of blood around, that I just got quite excited, and other people didn't. And I realised that there was sort of something in me that stood out in relation to kind of disease and sort of bodily accidents. And really after a long period of time, I started thinking, maybe I've missed my calling and maybe I should be a doctor. So eventually I ended up going to see some surgery at the father of a friend's operating theatre in London. And that was the moment really when I realised that despite my English and philosophy degree, I was actually sort of really powerfully wanting to go into surgery. And so I had to go back and do my sciences, which I hadn't got at that stage. I started my medical training when I was 24 and graduated from medical school when I was 30. And then sort of everything really went from there. And then I suppose sort of I had quite a conventional time in medicine, going through junior surgical training. I went and started training as an ENT surgeon. And it was around the time that I started having my children that I started having these kind of inklings that there was stuff that I wanted to write down. It was almost as if the old arts student that I had been suppressing for so long had kind of started to sort of make herself known again. And so it was that sort of early desire to write and really writing things down for myself that was the beginnings of my first book. And then I've now just published my third book in March of this year, and the TV work kind of came out of the book work. So I think someone from the BBC was at a literary festival and approached my agent kind of pretty much like haphazardly, and that was what took me into TV for the period of time that I was doing that. So
Oh, that's so inspiring. And I think something in our community that's not uncommon is Cavernomas bleed very unexpectedly, and you think your life's on one path and it has to take another, and that's really difficult. And people thinking, can I do that? Will I be able to make that change? And here you, someone who at a point where probably no one would have thought you were going to do medicine,
no.
you were in your late teens and then doing your degree. And
No, in fact, I remember, my parents, obviously, who were kind of always my advocates. I remember when I first presented the idea to my parents, and they just they were just completely flabbergasted. I mean, they thought it was a ridiculous idea because obviously, until very recently, I think we've always had this assumption that doctors are people who have to be really good at maths and science. And I think increasingly there are more and more medical schools that are beginning to sort of come to the view that there are all sorts of ways of becoming a doctor. And, there might be certain specialties in medicine that wouldn't be so great for someone like me, but actually there's lots that people who are perhaps a bit more arty can contribute to medicine.
And I think that's such an important message of hope. Is like, don't write yourself off. People may make judgments. You may make judgments about yourself, but if you have that passion, and that's really clear as you're talking, I feel that passion and that ability to see within yourself that curiosity of, oh, I'm interested in this and the way the others aren't around me and leaning into that.
Yeah, and I to this day, I just really hate it when I hear kind of teachers or kids talking about teachers at school, kind of still having this view that there are certain kinds of children that can go into medicine and then other people who are not suitable for it. I really feel that we've confined and restricted our view of what medicine is as a job and what kind of person could really end up being, a great healthcare professional of whatever leaning.
Absolutely. I think that's such a lovely and important message to share with people. And I think it's so nice as well for you coming to do this webinar and helping our community to connect with you in this way and showing that powerful medium of, having conversations with people and how
Yeah,
important.
I mean, I think I certainly when you guys got in touch with me, obviously I didn't know that there was a charity for Cavernoma, and I feel so lucky because our Cavernoma story, although it began looking very much as if it was going to be a catastrophic story, has ended, with a happy ending, or where we are now with it is a happy place to be, which is all we can ever know. So obviously incredibly happy and grateful to be able to contribute in any way to a community that, I think, as you and I have talked about before, is perhaps a bit of an unseen community dealing with a problem that is actually a really scary problem to have, isn't it?
And that's something we often hear from people is to have someone with your media profile talk about Cavanoma means our community is seen and heard, and that's so important. And Gabriel, you were touching there on that personal experience. Would you mind just sharing with us a little bit more about?
Yeah, of course. So my son Sam, who is 22 now and in the last year of his law degree and doing fine, I actually saw him briefly today, when he was 14, was a pretty kind of rambunctious, naughty, normal teenage boy. Very uncomplaining. Like, he was the kind of guy who was always in enough trouble at school and getting into enough mischief that he didn't need to kind of create drama by whinging about things. And so I mention that because when he started coming home from school about 6 years ago, actually in December, so it was exactly this time of year, and complaining to his dad and myself about having really severe headaches, it really stood out for us in a way that if that had been one of our other children, we would have perhaps not taken it so seriously. So for a period of about 2 weeks, Sam had these daily headaches that were not kind of eased with paracetamol or normal pain relief. Eventually, I made an appointment for him to go to the GP. And I remember speaking to the GP on the phone, I think. I'm not quite sure why she called us, but I remember the GP saying to me on the phone in a slightly disparaging way, "Oh, I mean, why the urgency? What do you think he's got? A brain tumor?" And I remember saying to her on the phone, yes, I actually do think that's what he might have, because I was already so worried. So he saw the GP, they couldn't find anything, they sent him home, the headaches continued. And there was one morning, which was the 18th of December 2017, where I walked into Sam's bedroom and he was lying in bed and just not on his phone, not doing anything. And I just thought to myself, this is really serious. So I bundled him up, got him in the car, took him to A&E, where they scanned him very quickly and discovered that he had a 4 centimetre diameter mass in his posterior fossa. Interestingly, at the time, no one raised the possibility that that could be a vascular lesion. So the poor ED consultant who was kind of seeing us initially just came to me and Sam and said, we found a mass, we think it's probably a tumour. And their initial kind of likely diagnosis was something called a medulloblastoma. So we quickly kind of went from, being in a normal sort of life to suddenly entering that kind of channel where everything feels very unreal and very scary. And yeah, things went from there. I mean, we were transferred over to Great Ormond Street the night after Sam went into A&E. And then it was at Great Ormond Street that eventually they were able to do an MRI scan. And the MRI scan was what was the moment where the consultant came to us and said, actually, we've been working on the basis that he had this brain tumour. And in fact, what he has is something called a cavernoma, which interestingly, even as, a surgeon with 10 years experience, 15 years experience, I think I had a kind of vague sense of what a cavernoma was, but I didn't really know anything about it, which seems kind of quite relevant, doesn't it?
Absolutely. And as you're just saying this, that experience of a CT scan and being told it's a mass, it's a tumour, we hear that time and time again on the helpline, and that absolute fear. And some people even being told, if they've been a couple spotted, given a sense that this could be terminal, and having to live with that. And my heart goes out to you, and I really feel that, having heard this several times before, that awful feeling of that period of time between the CT scan and the MRI
Yeah, I
scan.
mean, I remember we were on the day that we were transferred to Great Ormond Street, which was the day after we'd been told that Sam had a mass. I remember a paediatric registrar coming to talk to me, and she was talking to me about what was likely to be Sam's treatment. And I remember her saying to me very clearly, when it comes to his adjunctive treatment, whether that's radiotherapy or chemotherapy, do you want him to have that done at Sutton, or the Sutton branch, or the Fulham Road branch of the Marsden? So, we really, before anyone had arrived at a definitive diagnosis, I remember that very clearly, sort of the sense that someone was talking to me about cancer treatment, but no one had yet sat me down and said really what was going on. And I guess also kind of as a parent in that situation, even with a doctor's training, I was definitely experiencing that very normal sense of sort of my brain didn't really want to allow the information in. It was just an unbearable couple of days, really, where, I'm sure so many people have had this experience, but in my life, it stands out. Those few days were really terrible.
And it's something we often advocate for, is looking, thinking, what can we do to try and improve that time to diagnosis? So on average, we did a survey across Europe. Some people are waiting a year because of what you described. Headaches, they're dismissed. Symptoms, people are told you're stressed, you've been overdoing it, and people are listening to their own bodies and going, this isn't normal for me. And struggling to get that, and then being told things before people really fully know exactly what they're dealing with. Uh, not an easy steps that you went through, and so then you're at Great Ormond Street and you hear that news, and this
Yeah.
isn't something you're familiar with. What happened next then when
So,
you were
I mean,
told?
obviously, initially, the moment when the consultant took me out into the corridor and showed me the MRI scan and said, that's not solid, that's blood. Obviously, there was an incredible moment of realizing that whatever was going on in Sam's brain was not what kind of looked like it was going to be a pretty difficult tumor, medulloblastoma. I think, not an easy tumor to treat. So initially there was a feeling of relief, and the plan from the clinicians at that point was that they wanted to try and shrink Sam's cavernoma down in order to be able to operate on it in a more timely, relaxed fashion. And so it was just before Christmas. He was filled up with steroids, and we were given steroids to take home. We went home and had Christmas at home. And then a couple of days after Christmas, Sam started vomiting in the night. which obviously kind of raised our alarm bells again, and we took him back into A&E. And of course, this is probably something other people have experienced too, that even though we were patients, we were ongoing patients at Great Ormond Street. Great Ormond Street doesn't have an A&E, so during this process, we kept having to go to our local A&E and then be referred from there to Great Ormond Street, and it was all quite sort of inefficient. So on this particular occasion, they scanned him again, and they recognised the reason that he was vomiting was because he'd started bleeding again from his cavernoma. But they sent the scans over to Great Ormond Street. For some reason, I, to this day, don't really understand. We were told that the bleed was not significant enough to change the plan of wanting to shrink the cavernoma before operating on him. And then the following day, which was actually New Year's Eve, I went downstairs, and Sam at that point, because of his cavernoma, he could only lie on one side. He was very dizzy and he just couldn't turn over. And again, because of his personality being very uncomplaining, I remember him saying to me that morning, I just feel like my body isn't working. And I had this really strong instinct that was a kind of, I guess, a combination of surgical instinct and maternal instinct that Sam was going to die. I just thought, we are really in a bad, we shouldn't be at home. And then, so then I went into a sort of bit of a long wrangle where my husband and I were having to persuade Great Ormond Street on this occasion to take Sam directly back in, rather than having to do this kind of diversion through A&E again. And they did bring him back in, and they basically waited for all the kind of teams to come back from New Year's Day. And then they operated on him on the 2nd of January. 5-hour long operation, which I think is probably standard for a cavernoma of this size. And he did really well, so it was, as I'm sure everyone listening who has a personal connection with cavernoma, whether it's one in the past or one that they're living with at the moment. I mean, this is kind of standard stuff, isn't it, for cavernoma, but very much not standard stuff as a human being kind of walking through an otherwise normal life.
And something I was reflecting on is when we speak to people, they will often feel, as you did, frustrated with that, being told to go in A&E, but arriving, they're not knowing about cavernomas, having to retell their story, being dismissed or minimised. And sometimes will people say, am I not doing enough? And I think actually it's a really powerful thing for people to hear how you, as someone who is a clinician, a surgeon, and you're still struggling. And I hope people will take from that is, don't feel this is you. It is unfortunately the pathways for rare conditions, conditions like these aren't as they should be.
Yeah, I mean, I hope that things like Martha's rule, that Maripy Mills has kind of established now because of what happened to her daughter, I hope that things are sort of improving in some ways in terms of kind of patients being listened to, patients' families being listened to. But we all know, don't we, that, the NHS is in a particularly sort of unresourced and terrible state at the moment. And, that is the reality of what we're up against. But I definitely think, I think it was much easier for me to advocate at certain points for Sam because I had that sort of surgical authority. So it wasn't perhaps so easy to gaslight me as a mother as it might be for some other people. And I think obviously that is very regrettable. But I definitely think in cases where people have a very strong instinct that they're not being listened to and that something's wrong, I would absolutely advise that, with whatever strength the person has, that they just kind of have the confidence to keep pushing and keep complaining and keep asking for, what they need. But it's much easier said than done, isn't it?
And especially when you feel very vulnerable because you don't have the information and the knowledge. And you talked there about Martha's Rule and how people's rights have changed. So for those who aren't familiar with that and might not know about PALS, could you tell people a little bit more about that and their rights?
Yeah, so Martha's Rule is basically something that is now kind of established across most hospitals, if not all hospitals in the UK. And what it basically gives anyone the right to do is to phone a number and ask for a second opinion, if it can be a patient or a relative of a patient or even a healthcare professional working for a patient, now has access to a number that means that they by law are allowed to ask for a second opinion to be given in a situation where they might be worried that a patient is really going downhill and that the clinical team, for one reason or another, is not recognizing the severity of that. And that was set up by a woman called Merrippy Mills and her husband as the consequence of a relatively minor injury occurring to their daughter, who fell onto the handlebars of her bike, which turned into full-blown sepsis and actually ended up resulting in her dying. And their big kind of, their big campaign, I suppose, was over the fact that they felt that they had repeatedly tried to alert the team to the severity of their child's decline and that they weren't listened to adequately. So, and then you mentioned PALS as well, which I guess is just every hospital's sort of department that is there dedicated to allowing patients to complain or give voice to concerns where they feel that their care hasn't been adequate. I mean, the only thing I'd add as an adjunct to that is it's sort of hard to imagine how much kind of brunt of difficulty those sorts of systems can withstand at a time where there's just so much need and there is so little of that need being met in the ideal way. And I don't know what we do with that, but I think it's a real problem.
It's so difficult, and we hear this where people say to us, I know my clinicians are trying to do the best, but a letter's gone missing or something's been delayed. And there's that balance of people being understanding about the individuals holding their care and then really frustrated with the system.
Yeah.
And I think, as you've said, you trusted your instinct and you spoke up. And we often say to people as well, that's the only thing you can do, is trust that instinct, speak up,
Yeah.
and use those resources like PALS, be
Mm.
knowledgeable about Martha's Law.
Mm.
But it's not easy at that point. And Gabrielle, I've had a couple of questions come in as we're talking,
Yeah.
and one of the things people are really interested to know is about whether your son, whether it was just the one or whether he had more, and whether it was sporadic or familial cavernoma.
Yeah, so that we asked about that. So we kind of, when we were in the throes of everything going on, we wondered whether, as a family, we've got three other children, we wondered whether there might be a kind of good basis for scanning all of us. But in fact, we were told, because Sam only had one, that the likelihood of his cavernoma being a familial pattern was pretty low and kind of wouldn't warrant all of us being scanned. I mean, it's interesting that a couple of years after Sam's cavernoma operation, I had to have a heart scan done because I've got mitral valve disease. And that heart scan incidentally picked up a 7 centimetre cavernous hemangioma, which is kind of histologically basically the same as a cavernoma in my liver. But of course, it's not called a cavernoma because it's not in the right place to be called a cavernoma. But I've always wondered since then, and that just sits in my liver. And sometimes when I'm doing yoga, I slightly feel it, but I've been told it's probably going to sit there till something else gets the better of me. So as far as I know, it is not a familial pattern. It was interesting when we were at the point where we were being discharged from Great Ormond Street, the lovely neurosurgeon who had correctly intuited during the kind of main part of Sam's stay in hospital that I wouldn't be able to take any more bad news, just held back for the final conversation that during all the scans they'd been doing on Sam, they had picked up that he also has a sort of a tiny benign brain tumour elsewhere in his brain, which, you can imagine when I was told that sort of on the way out of the hospital, my heart nearly stopped again. But I mean, I think that's was referred to essentially as an incidentaloma and kind of something that's unlikely ever to need anything doing to it. But I mean, it's funny, isn't it, that when you start scanning people and families and like you don't know what you're going to find, and some of what you find you maybe didn't need to know about.
those questions you have, we often hear from people who they're told, like you were, it's a single cavernoma, it's highly unlikely it's inherited. We can't do genetic testing or further scanning. And a lot of parents, though, come to us and say, but I want it. I need that reassurance
Yeah.
because even though it's a very small chance, and then those ethical dilemmas. And we've had this conversation with our advisory board saying, should we be advocating for the guidelines to change? Should people have that right? And then those ethical discussions about, as you've picked up on, it's then sort of thinking through the consequences. It's an intervention. Should
Exactly. And I think that one's reaction to that sort of question, I think it's, we all have slightly sort of different takes on that, don't we? And I think a lot of that maybe isn't even to do with medical evidence. In my case, I think my sense of not feeling that we needed that, it probably just says a lot about who I am as a person, and a kind of almost a philosophical sort of position that I take. Not that, nothing kind of woo woo, like everything happens for a reason, not at all, but a sort of, I do think I have a bit of a philosophical position of everything's fine until it's not fine. I definitely haven't lost any sleep wondering about my other kids in Cavernoma, but at the same time, if one of my kids were to start getting regular headaches, I would have a higher index of suspicion for them than I did when Sam first presented with that. But I suppose we all, when we have experiences like this, we become very focused on this one thing that life has given us that is difficult. And of course, the reality is that one thing, having a cavernoma, doesn't protect you from any of the other problems that life will throw as well. And so I think I sort of felt, when this episode of Sam's was sort of drawing to an end, I just was ready to not put it behind us, because I don't think I've ever been able to do that. But I personally didn't want to go looking for trouble, if that makes sense. But I think that's just me. I totally understand why people would feel differently than that.
and I think it's lovely you acknowledge that range of experiences because people's experiences do vary, and also that is not uncommon. People are like, right, it's been removed. I want to do the next stage, and so in terms of so Sam's gone into theatre. You've advocated for him. That was necessary, and people on this call who've not yet had that experience of surgery, perhaps on a medical management pathway, wait and see, and they're wondering what does that look like in terms of those first few days when he's recovering. Would you
I
mind
mean,
if you feel
yeah,
comfortable?
I mean, the thing the couple of things that spring to mind that were really interesting to me, the first of them was that, as a surgeon, as someone who loves being in the operating theatre and who has an endless curiosity about surgical procedures and details, I was completely not wanting to know anything that happened in that operating theatre. So I remember there was a very nice junior nurse, a male nurse, who had been looking after Sam on the ward and who went down to theatre and was able to see Sam's surgery. And I remember when Sam finished, it was this young nurse who was the first one back on the ward to tell us that it was okay, that he was okay. And he was so excited because he'd been in this very, very kind of, well, gory operation, I suppose. And he was like, oh man, he started telling me about it. And I remember just saying to him, don't tell me
Whoa.
anything. Don't tell me anything that you saw. Don't tell me anything that happened in that room. So that was one interesting thing. But in terms of like how Sam was, the really noticeable thing was that in the period of weeks where he'd had the headaches, and then when he was properly unwell at Great Ormond Street, he was very subdued. And he is not a subdued person. He's really, I think wild is an appropriate word, and certainly was when he was 14. And when he came out of theatre, we went down to recovery to see him, and his face was all puffy because obviously he'd been lying for his surgery. He'd been placed on his front so they could operate on the back of his head. And the first thing he said after checking with one of the recovery nurses that the cavernoma was gone was he just started swearing, about basically swearing at the Cavernoma that was no longer there. And remember, my husband and I
Picked
looking
and
at
let
one
it all
another
out.
thinking, he's back. You know, it was like a
That's our boy.
restoration of the wild boy once the Cavernoma had come out. And then, honestly, over the next few days, and I would imagine this would not be typical for adults, although I don't know, but because Sam was 14 and then, springy and just so determined to kind of get back on his skateboard, get out of the hospital, kind of get back into his life. Every time the OT and the physio came round and sort of offered to start doing things with him, he just wanted as much as they would do, and kind of he didn't want morphine, he wanted the catheter out. He was he was actually in many ways what a surgeon would consider to be an absolutely perfect patient. He was incredibly motivated to kind of move forwards. And I mean, amazingly, they discharged us from hospital 3 days after his surgery. And about 2 days after that, he came to me with his skateboard under his arm, having been told that he must not skateboard for, I think they said 6 to 8 weeks or something. And he
Sounds
came
wise.
to me with his skateboard under his arm and he said, you've got a choice, Mum. You either come and watch me or you don't come and watch me. So I remember thinking, okay, that's what I'm going to do. And we walked up the road, and there's this place at the end of our road here where there's a little estate with a kind of quite a sort of gentle slope. And I'll never forget the sight of Sam, who lost a lot of weight, with this dressing on the back of his head, just tentatively getting up on his skateboard less than a week after his brain surgery and going down this bit of tarmac drive. And
Your heart
kind of,
must have.
it was funny because it was almost like, I was afraid for him, but I was also so overjoyed to see that it
Mm.
hadn't kind of taken away who he was. I mean, it was scary, but it was wonderful. And he really did. And we had to go back a couple of times, I think, to Great Ormond Street, because I think with all the skateboarding and so on, I think there was one point where the bone plate at the back of his head, which had been kind of, put in position with bits of sort of titanium, sort of chainmail almost, isn't it? He started feeling the bone plate was kind of rocking around a bit. We went back, and there was a lovely registrar there who got quite stroppy with him and said, what do you expect? It's like, how do you think your brain and your skull are going to heal when you're carrying on like that? And he sort of simmered down for a little bit, but not for very long, I'm afraid.
It must have been so reassuring after seeing him so poorly for a
Yeah,
boy who's clearly incredibly spirited and which sent the alarm bells when he wasn't, to
yeah,
then see him full of life again.
yeah,
That must have been both
yeah.
worrying and incredibly
Yeah,
hopeful.
yeah, and it's funny. I'm not a sentimental person, and I'm not a person who usually is very attached to dates or kind of anniversaries of any kind. But I have to say that the 18th of December, which is the day that I first took Sam into hospital, every year on that day, I remember what that day was and that sense of almost, well, not knowing which way life was going to go, whether it was going to be sort of derailed forever, I suppose, or whether we were going to get back on track, which we did in the end. But I realized that for some people that is not how it goes. And I can't imagine how difficult, well, I can partly imagine how difficult that must be, but I'm sure there are so many stories of your members and supporters that that some of this will resonate with, but who have had a much more protracted, difficult time than we did as a family.
It's really true. And I think also for those members who are finding it harder, sometimes hearing these stories can give a bit of hope. To hear someone else's experience has been better. And in the chat, I've got people there, and I'm just thinking, gosh, it's the 10th of December. We're 8 days away from that anniversary. And as you come up to mark that, people are wanting to know, what is he doing now? And we're also wondering about his ongoing care. Is he getting
Yeah. So he is, which this is kind of like a big family joke. He's in the final year of his law degree, which we all find kind of quite hilarious because he's not someone who's ever been too observant of the rule systems. Um, he is still a very, I mean, spirited is a very nice way to put it. I could put him somewhere on the spirited to wild spectrum at any one time. But in terms of sort of kind of overhang from that experience, he's left hand dominant, and he has a bit of a tremor still in his left hand. So if you were to observe him doing something unlikely like pouring a teapot, you would notice a tremor. Sometimes when he is eating with a knife and fork, you can notice that his left hand has a bit of a tremor, but not much. I mean, I think it's a pretty small thing. And certainly in the months and kind of early years after his surgery, he was at pains to cover the scar on the back of his head. And I think I've got a picture here somewhere. Let me just see if I can find it. He now, oh, here we go. I'll just try and see if I can show that to your screen.
Yes, we can see
That's
that
Sam
proudly showing it off. There's no hiding there.
That's him showing his scar. So he now, I think he gets a certain amount of, shall I say, favour for his scar now. I think he finds it quite a socially advantageous skin marking. And yeah, he's just a great young man. I mean, he's not a conventional guy. He never was going to be that, but he's completely fine. And I think it's so interesting, isn't it? Because again, I mean, I was talking about personality before. I think Sam was always quite a resilient and straightforward person. I wouldn't describe him as like a super sensitive person or what have you. And so, I mean, I've never heard him talking about his Cavernoma as having, he doesn't talk about it in terms of trauma. I mean, of course, it was a trauma, both in the literal sense and for sure in the emotional sense. But I think he's fine. I think he's absolutely fine. I think it was something really terrible that happened to him that he has bounced back from. I hope so. I mean, you never know with your kids, do you? You never know quite what they're carrying around that they don't show you all of. But he's great. He has a full, totally unrestricted life as a result of the care that he received. We often think as a family, if we had been in a different part of the world, that, you know, he would have died that winter for sure. So it's not something that we ever take for granted as parents, that's for sure.
And I think something I'm hearing from this, thinking about your journey, the unconventional journey, and just your instincts doing what you wanted to, maybe even a touch of spiritedness there as well.
Definitely. I mean, definitely. I think Sam is kind of, I mean, I had plenty of that. My husband, I think, had even more. And Sam seems to have got sort of, depending on which way you want to look at it, the best or the worst of both of us, plus an extra piece that's just all him. Yeah.
Just had a question coming around Sam's siblings. So does he have siblings? And oh, you mentioned actually he does.
Yeah. So he has a 19-year-old sister who has just started a nursing degree in Edinburgh, and identical twin 12-year-old sisters who are 12, who are downstairs. So our older two kids are now, you know, they're back at home for Christmas, but they're basically off doing their different uni things. And we've still got our youngest ones. I mean, we're becoming properly elderly parents now. We've still got sort of embarrassingly young children who have just gone into year 7, the twins. So yeah, it's a pretty busy house. And when Sam was unwell, the twins were 4 because they're 10 years younger than him. And, you know, at that time, we didn't have any childcare. So it was my husband and I sort of managed at that time to kind of, because we live in London, so we were right next to Great Ormond Street, we had one of us with Sam all the time and the other one at home with the other 3. And, you know, obviously we were doing jobs and had a work life that gave us enough flexibility that we were able to do that, which would not be the case for a lot of people. And I remember in the bay that Sam was in the intensive care in Great Ormond Street, which was a bay with 4 beds in it. I remember there was one couple there who had a very young child, I mean, still in a cot, And those parents who I think were both shift workers were, coming in as frequently as they could. But I remember how difficult it was for them to kind of fit that in with their work life. And I remember thinking to myself, there's always an element of something where the situation could be worse than it is. And that was one of the things I remember thinking for myself. At least we have the sort of space in the flexibility in our lives to be able to accommodate this crisis in a way that means that, and also during COVID, I just can't count the number of times during COVID that I thought to myself what it must have been like for parents during that time with children unwell who they weren't able to be with. Because I actually think Sam would have been fine, but I wouldn't have been fine without that ability. When I was feeling so powerless, it almost felt as if the ability just to be there was the thing that I was able to give to the situation. And it must have been very difficult for people who weren't able to do that during COVID, or who might not be able to do that now for any number of reasons.
I think there's the importance of being able to be present, those social connections through this. And then I think when we meet up with people, people often talk about the loneliness. You can be surrounded by people, but the loneliness of other people not understanding this condition, and often the symptoms being invisible to others, and telling relatives, and they're going, "Well, you look all right," and the importance of those connections with other people who are going through that, how important that is. And so, Gabrielle, thinking about all of that experience, and then you've got your writing, your literary outlet. You've got, and I think it's fascinating. This sort of, this woman is very interested in the detail and surgery, and then you've clearly got this flair for writing and telling stories, which I think is such a wonderful combination. And there you've been the mum and the person on the other side, and not being the doctor with the patient. How do you think that's influenced your writing?
I mean, I think the primary way that it's all affected by writing is that the book that I just brought out this year, Alive, took nearly 10 years to write. So I think all of this kind of big life stuff just really, really slowed me down. So it's funny, isn't it, that, kind of you might think, and I think I thought, that if you're given this sort of material, as it were, and I was writing a book about the body, so in a way, what happened to Sam, you might think that you were handed the most amazing material on a plate. But the reality was that that experience and other experiences that were happening in my family around the same time that were also difficult just derailed me from writing completely. Because I think the interesting thing with writing is that whilst, your reader does want to connect with the authenticity in your story, what they actually don't want is the raw expression of you having those feelings without filtering them through some sort of narrative process. And so I just had to accept, and my publishers were incredibly patient also in accepting, that a book that was meant to take 3 years to write ended up taking 8 years to write. So I think that honestly was the biggest impact that was felt on my writing. I do feel, as a doctor and as a surgeon, that the experience of Sam being ill and his cavernoma has completely changed the kind of doctor I am. And I'm not sure, a manager wouldn't be able to look at the numbers of people I operate on, or the wound infections, or the quality of the scars. Like, you wouldn't be able to see the difference in those sorts of metrics. But I really noticed quite shortly after going back to work after Sam was ill, that patients just started telling me things. I mean, obviously, in an operating theatre, and most of my operations nowadays are under local anaesthetic, so people come in quite stressed, but they're conscious, so they're there and ready to talk to you. That the sorts of things that people started to let me know about and started to talk to me about were just different. They were much more intimate and much more difficult than the sorts of things that people had talked to me about before. And that has just felt like such a privilege to me. I mean, it really, every week, and I'm off to the hospital to operate tomorrow. Every week that I go in, I come home and I just think, I just can't believe that a person I've never met before just told me what they told me today. And I like to think that that experience of a child nearly dying has just removed a sort of carapace from me that I think historically we were taught was essential as a doctor. I think we were taught you need that kind of outer armor and you need the distance between you and the patient. And I just don't think that's true. I mean, of course, there are boundaries and there are time constraints and there are things that have to be done. But I really feel now that in my interactions with patients, I'm much more porous in a way to whatever is happening in the room for that other person. And it's really kind of been a very rewarding chapter as a doctor, being able to do that. And I think we need to do that more.
And I think, well, I can't believe where the time's gone. We've got only 10 minutes now before I'm going to open up to questions. And I've just been so absorbed in hearing your story. And this feels like such a natural point to open to questions that something so hard and so extraordinarily tough on you, your son, your husband, your children. And then you've taken that, and it sounds like a book that needed to wait 10 years as you digested that, and they're in a position to give that back to people. And I think there's such a strength that you're talking about in not being the doctor who knows everything and is impervious to feelings, to show your vulnerability.
Yeah.
I think there's a huge strength in that. And I just want to say thank you.
No, it's such a pleasure. I mean, honestly, it's such a pleasure to be able to talk about these things. And I think it's such a wonderful forum. And I really understand in a way that obviously I didn't before, that I think with Cavernoma in particular, it is one of those things, isn't it, that most people haven't heard about. And I just think the fact that you're providing a place where people can come, where they know that they are recognised for what they're going through at whatever stage in that journey they're at, it's really an amazing thing. And I feel really honoured to be just a tiny little part of that. And I'm really glad that I wrote about Sam. Very grateful to Sam for having given me permission. I do remember one moment when he was in Great Ormond Street where I'd gone down to Ryman's to buy an exercise book because I thought I've got to write down everything that's happening, because I can't really trust myself in my current state of, not sleeping very well to remember what all the doctors are saying and in what order and what have you. And I remember coming back into the room that Sam was in with this notebook from Ryman's and him just looking at me. I can't remember whether he'd had his surgery or was about to, and he just looked at, gave me a really direct stare, and he was like, "Mum, you are not writing about this." And I remember thinking at that moment, I think I am though. I remember thinking I'll have to talk to him about that later, which I did. But that was one of those slightly shameful moments where the writer in me was still there, even in the room with the mother.
Oh, well, I'm just going to say to anybody now, I've actually had quite a few questions come in. I'm going to just quickly skim to make sure I've not missed any. But if anyone's got any questions for Gabrielle, it's such a unique opportunity, please do pop them in the Q&A. I'm just scanning through now. I think a few actually we've covered. One of the questions is about, how do you think he felt through all of this? And I think particularly for parents on the chat here today, and teenagers aren't always the most communicative, although I think you're Sam, and how do you think he felt through all of this?
I mean, I remember when we were in the room in A&E when we were waiting for the results of the CT scan, and we were both scared at that point. And I remember saying to him, "I promise that whatever happens, I will give you the adult version of what's going on. I won't hide anything from you." And I think that was really helpful. That's not answering how it was for him, but I think that approach, which might not work with a younger child and might not work with a different kind of child, felt very important for him, a sense that there was at least power in knowing what was happening and having someone be direct about it. But I remember one night when he was definitely before he had surgery, probably his first or second night in Great Ormond Street, where because he could only lie on one side, as I was saying earlier, he couldn't turn over. The way that he was facing in bed was the opposite side of the bed to the fold down bed that they had provided for me to sleep on. And I remember being really troubled by the fact that if I slept in that position, I'd be at his back and he wouldn't have the comfort of knowing I was there. And I was going to get one of the nurses to help me bring the bed round the other side. And then I remember Sam saying, no, 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 it's fine. You're fine there. It's really nice having you there. And so I went, I went and lay down there and had the night there. And then a long time later, I think years later, he confided in me that he had wanted me to stay behind him so that he could cry without me having to witness it. And that was a real moment for me of thinking he was doing a really good job of being brave. He is brave, he always has been. But I don't think I realised the extent to which he was being brave. And it's quite sort of heartbreaking, isn't it, that story? And the other thing that was really bizarre was he had a phone. He previously didn't have a smartphone, and then his dad went and bought him, when he was admitted to Great Ormond Street, he just didn't know what to do, went bought him a really fantastic smartphone. We just didn't know what to do to make him feel better. And I remember he was watching a series called Narcos, which is like really nasty kind of gang related drama, where a lot of people
The stuff at home, you would have totally said no.
exactly, and a lot of people sort of having their brains blown out with guns, and that just seemed like the absolute worst thing that someone could be watching whilst in Great Ormond Street awaiting brain surgery. So yeah, and there were lots of McDonald's being bought for him and all sorts. I mean, all bets were off, to be honest, during that time.
I think you're allowed, aren't you, in those moments as parents? It's just, we can only do what we can do.
Yeah,
And where he is now, doing what he's doing,
yeah,
clearly supported by two very loving parents.
yeah.
Um, and I'm sure he's incredibly, as proud of you are of him, he is of you
Oh,
through all that you've done. And Gabriel, we're coming to the end of our time together now with the Cavernoma community. It's been such a pleasure. And as we come to that time, I'm just thinking, is there, for those, we have some people on this call who've been living with Cavernoma for a while, some who've had it resected, still in touch with the community, and there'll also be some who have only recently been diagnosed and at the really start of this journey.
mm.
And for those people, is there anything you would say you've learned through your experience that you'd
I
like to share
think
with them?
I think the most helpful thing that I did during the time with Sam's Cavernoma, where the outcome was completely not known to us, and we were having to really consider the worst possible outcome might happen. What I would do when things felt completely overwhelming is I would just think, okay, I'm just going to break this day down into as small a unit as is required for me to be able to cope. So sometimes that might have been, I'm just going to think about getting till lunchtime, but sometimes it would be way shorter. Sometimes I'd think I'm going to wait until the clock in the wall on the ward in Great Ormond Street has got 5 minutes beyond where it is now. And all I have to do is be in that unit of time, not how I'm going to feel in a year or a week or 10 years, or like all I have to do is just this particular piece of this incredibly difficult journey. And then that moment will give way to another moment, and that will give way to another day and to another week and to another month. And at some point, it won't feel like this anymore. And I found that not only incredibly helpful in that situation, but I have found that incredibly helpful in many other subsequent situations where I've kind of almost gone back and used the skills that I learned during Sam's Cavernoma journey to kind of just remind myself that, you know, you don't have to look at the whole big scary picture all at once, particularly when you're, you know, right at the start of it, as you say.
Such wonderful advice. I'm thinking I want to write this on our website straight away. Just a heartfelt thank you for raising awareness about Cavernoma,
Not at
which
all.
means so much to our community, but also for telling the story because as a mum resharing that, I felt choked up at points
Yeah,
retelling.
no, it's a biggie, isn't it? I mean, it's, you know, it's big stuff, all of this, but I think it's good, isn't it? It's good to talk about big stuff, and you know, I feel, as I said, really honoured to have been invited on, and so thank you for having me.
Well, thank you, and by you being so open, it gives other people that permission to be open too.